Hello, everyone, and welcome to another episode of the MedEd Well podcast. Today, I am honored to have as a guest Dr. Diana Mercado-Marmarosh. Dr. Mercado-Marmarosh is a family medicine physician, clinic medical director, and chief medical officer. She is also the founder of Overachieve Life Coaching. Prior to discovering coaching, Diana typically had 200 charts open and a graveyard of unfinished projects. But that has changed, and now she's on a mission to help physicians and medical students create systems that are simple to implement with ADHD, supporting their zone of genius and reclaiming 5 to 10 hours per week of their personal life. Her clients learn to leave work at work. She is happily married with 2 preschool-age children and enjoys travel, painting, Zumba, yoga, nidra meditation, and exploring different cultures. Dr. Diana, welcome to the show.
Thank you so much for having me. It's a pleasure to be here.
Thanks so much. Tell me a little bit more about yourself and your journey to medicine.
Well, I didn't really think I was going to go into medicine. That's a funny story, actually. I actually got a scholarship to study international business. So a part of me wanted to travel the world, and I figured that business was the way to do it. So you could travel the world and see and get paid to do it. But when I was in high school, I actually joined a program that was called Upper Bound Math and Science. And I was going for the math part of it because I figured maybe this would teach me accounting or they would teach me some type of business. But of course, it was really just geared towards science part of it, mainly because like we got exposed to surgeries and like family medicine and like very cool things that I would have not had the opportunity to do from where I was at in South Texas, because I didn't know anybody who was a physician. So I wouldn't have had that type of exposure had I not gone to that program. And that program was actually 2 summers, and it was in Oklahoma, and I'm in Texas, and in South Texas. That's where I grew up in Mexico till I was 10, but then I was in South Texas, and even though it was Texas, it still felt like Little Mexico because everybody spoke Spanish there. So it didn't really make a difference, and everybody around me looked kind of like me. So when I went to this program, it was like my first encounter with like diversity. And in my mind, I knew we were all the same. Like, that's what I thought. But it was beautiful to actually start to see it and have friendships and develop friendships through that. So in my mind, I still kept thinking I was in denial, even though I went back to high school and took all the science classes and all that. Like, I was in denial that I was going to do science. So I get to college and I didn't even last a semester in business. And then I was like, this is boring. And I went to science. I decided I was going to be a physician. But I guess now life has its turns. Maybe I did know a little bit of that about that. Now I'm hoping to still merge my love of traveling and doing business and even now doing retreats somewhere and engaging that. So it just shows you that you don't know where your journey is going to take you.
That's so great. Thanks for sharing your story. Just each of our own individual experiences, our personality, they all get to be brought together if we let them. And then that's our unique expression of how we can care for our patients and provide value to others around us.
Yeah.
So for you, balancing all these things, how did you kind of deal with jumping from one thing to another? Or how has that been for you, kind of being able to focus on each of those different areas?
Yeah, so like I said, I always wanted to travel, but I never really thought I was going to be doing the business part of it, because in my mind, I felt like that was too many details. And I wanted to just go in somewhere, see my patients, not advertise anything, and then like get a paycheck somewhere and like not worry about how the money came in or what happened, and not worry about, does this one have insurance? It doesn't have insurance. Like, I just wanted to do the doctor part. And then pandemic hits, and all of a sudden, like, you could not you could not take that break like everybody else was taking a break, because out of necessity you were expected to show up, and all kinds of stuff like was brought to the surface for me. I was like, why? I signed an oath to do no harm. I didn't sign an oath to put my family at harm. And all
Mm,
kinds of feelings like were being brought up, and I was being forced to like process that I was having to do, you know, a, a will to say who my 2 and 1 year old were going to go to. And I was so
mhm.
mad about that.
Yeah.
And I felt like I was hopeless, and I felt so like crushed, because the thing that I loved the most, which was to take care of others, was the thing that was basically maybe going to cost me my life. And I did not
Mhm.
sign up for that. And so I started to think, like, is it really worth it for me to be charting 20 or 30 hours outside of work on something that
Mm,
I'm kind of detesting in this moment in time? And I started to realize that maybe it didn't have to be that way, but I still didn't even know that I was living in burnout. Like in my mind, I felt like
mm,
as a female physician with little kiddos, like you were just expected to do all those things. Like you were just supposed to do everything for others without setting boundaries, because you were taught like do everything for your patient, like your patient always comes first. But when I was
mhm,
forced to be like, okay, your family or you or your patient, like that's when I started to like question, like, okay, what if I really did only have 24 hours to live? Like, how would I live my life? Like, what would I really do? Like, what type
mhm,
of patients would I really want to talk to? Like, I don't want to talk to those that tell me off, you know? And so like
mhm,
I started to like just question and wonder and start to dream again. Like, what if there could be something different? Like, what if I could practice medicine in my own terms? What if I didn't just have to do everything that the insurance tells me to do? Like all these prior authorizations, all this like time sucking activities that don't necessarily give you a return for your time, right? And I think, and believe me, I was a hot mess. I was a really hot mess. I was charting 20 to 30 hours outside of work. I
mhm,
was always feeling like I had all these wonderful projects I would start, but I wouldn't complete. I
mhm,
felt like I I kept asking myself, what's wrong with me? I'm a physician.
mm.
Why can't I just adult? Like why can't I
Yeah.
just have a clean house, or why can't I just da 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 da?
Mhm,
But I didn't realize that I was neglecting my diagnosis of ADHD.
mm,
I got diagnosed as a first year medical student with ADHD.
mhm,
And when I became an attending, like they were like, you're an attending, like you need to go see your psychiatrist. Like don't just keep coming to the student clinic, like you're no longer a student, go see a psychiatrist. And so I was
mm,
like, okay, fine. And so I was at Baylor, and I was like, okay, well, I mean, I think any random psychiatrist should be able to understand ADHD in professionals. Why didn't do my due diligence, and I just showed up with somebody, and that person didn't even give me like 2 minutes of his time, and he was like, you're a
mm,
physician, you should know better, you outgrow ADHD. And I didn't question it, because I was like, well, I'm just general doc, I'm not a specialist, so he must be right. And like I felt embarrassed and ashamed, and like I just left. And like for 10 years I neglected my diagnosis. I just told myself, well, it would be okay. Like I got this far, at least I passed all my board exams. I should be grateful that I'm even here. And so I told myself I'm just gonna keep working harder and harder. Like I can work hard. Like I know that it'll pay off. And it was like a love-hate relationship, because it was a privilege to be able to take care of my patients, but it was a like I hated the administrative part of it, where I had to write all these notes, because I was like, how come nobody was paying attention? I just did an amazing job up there. Like somebody should have recorded that. Why do I still have to write a note?
mhm,
And my mind would tell me things like you're too slow, or you're not writing it right, or you know. And of course, like who's to say you're too slow, or you're not writing it right? Like I've had to later discover that some of the thoughts that we have, like they're just there and doesn't mean they're true. But if we ever question them, like you keep buying into that same thing. Like it wasn't until one of my coaches was like, okay, so which English class did you flunk, or what Spanish class did you flunk, or what did you flunk that was a writing class? And I was like, well, none. And then why is your brain telling you you don't know how to write? And I was like, oh yeah, I guess I didn't think about it that way. And so I say all this because there's so many times that we don't realize that we, out of preservation, we are living, we just have habits and we do routines that we don't even question. And we think that, well, they got us here, right? But we don't realize if they're going to get us there. And that's why all of a sudden I knew something had to change. I just didn't know what. And then I heard about coaching on one of the podcasts, and I joined Sunny Smith's Empowering Women Physician group. This was in October of 2020. And I didn't go in there thinking I'm going to start a business. I just went in there because she said there was some CME credits, and she said that it was going to help you like be better leader or something like that. So I was like, okay, I can do that, you know? And so while I was in there, I saw like how normalizing it was to start having conversation of what it meant to like have feelings, not keep masking stuff, realizing that we've all gone through challenges and that you're not your challenge. Like, and so I came to realize that ADHD, I could see it as something that was disabling to me, or something that could be used as a superpower, because with ADHD, it's a spectrum, and it's either you're told you're too much, or you're told, oh, that great job, you're being such a great leader, like you spoke up, you said whatever, right? And so it could be like good and bad, but at the same time, like I didn't make it mean anything if I messed up something, because I just knew it might take me a couple of trials until I got it right, if that's what I wanted to do. And so it could be seen also as persistent, right? Or insistent, or whatever you want to look at it. Stubborn. My husband says stubborn. But the point is that the more that I was in that program, I realized that maybe coaching was a way for me to help myself, and maybe to help other people who might have similar experiences as myself that maybe they weren't even talking about. And so I decided to share my story in February of 21, and that was in a podcast that was called Tracy Atsuka's ADHD for Smart Ass Women. And it was the first time that I talked about my story, because prior to that, I think I had told 5 people that I had ADHD, because to me, it was a very shameful thing. And when I did that, all of a sudden, all these people from all around the world, medical students, physicians, all around the world, Australia, Canada, Brazil, like they started emailing me and telling me, wow, I really related to your story. Like I could have said everything. Like I thought I was the only one. And that, like, that just moved me so much to be able to tell, like, somebody somewhere is listening to a podcast, like you don't even know who it could like impact. And it was through that I was like, okay, I don't see anybody saying that they're specifically helping this type of high achieving people. Why not me? Like, and they don't have to tell me a lot of stuff. I already know. I've been coached on all that. So by the time I decided to start to understand my diagnosis and not to make it mean anything, like I was like, well, I don't shame anybody for having diabetes or high blood pressure or cholesterol. And they have to have information in order to do something about it. Like, why don't you get information about it so you can do something about it? So I came to understand that ADHD started and ended with me. Like I could use it as a way to empower myself, or I could use it as a way to cripple myself. Like it could go either way. And so I knew I didn't have any time awareness. I knew I had to start using external cues. And so with, some using timers, somebody comes and knocks on my door and says, "Hey, Dr. Mercado, do you need anything?" And then I say, "Yes, I need a TDAP, or I need a UA, or I need the labs printed, please, or do you have a sample of blah, blah, blah." And so it almost became then part of like the routine. And so I knew that when they came knocked, I should be wrapping it up. I should have entered orders. I should have done something. And of course, I know that it is what it is. Some patients take a little longer, some take some, but it gave me a starting point, a way to then set up a different routine instead of being 3 hours late, to be maybe an hour and a half or an hour late, right? And so it just started to change. And believe me, I had to learn that it was going to take whatever it was going to take, and I wasn't going to make it mean anything. And then when I would walk in, instead of saying sorry for being late, I started to say, "Thank you for your patience. It's so great to see you today." And of course, it changed for me, because then I didn't feel already bad to start the relationship with that patient, saying, "I'm sorry," like you're always almost like an inferior, even though like they don't know you haven't eaten or you haven't done X, Y, and Z, and you're still, like, and so I had to learn all these boundaries there too, to say, "Yes, I would love to see you, but not an hour later than your scheduled appointment. So like, yeah, come back next time," right? So you just have to learn to realize that you were the most important patient in the room, not that you were. And when you knew that, and you were aware that, how am I doing? Did I eat? Did I not eat? Did I do a 5-minute meditation? Like when you started checking in with you, then everything else changed, because then I wasn't sub-functioning. I was fully functioning. And I didn't even realize I was sub-functioning, because I had been the norm forever. And again, it was that love-hate relationship. Like you love your patients so much that you keep showing up, but then you pay for it later.
Yeah. Well, thanks so much for sharing your story again. And I think it's really helpful just to see how some of these things being brought to your awareness through coaching and just others speaking into your life then allowed you to say, it's like, okay, what story am I telling myself? What am I feeding myself that has been so ingrained that I believe it? And I think sometimes we just have to push back against some of those things that may be explicitly taught or implicitly taught. That hidden curriculum in medicine says, oh, it's like, well, this is the ideal situation, and this is the perfect thing, and this is how much time we're giving you. But every patient's different, and I want to be fully present with each of them. And so I really liked what you said. It's like, hey, thanks for your patience. I'm so happy to see you today and be able to help you with whatever you have to bring to your session.
Yeah, because now you're starting from a place of like gratitude that they're there, instead of a place from like shame that I'm late that I walked in, right? It's such a different energy in the room. And of course, I mean, it's not like everybody's always gonna be like grateful that you took so long, right? But once they see that you're there and you are fully present, like it changes. Like, and of course, you always have some that you're just like, well, bless you on your way out, right? But it is what it is. And you have to learn yourself. And it's how you present it. Everybody's different. And that's the beauty of it, because I love to joke around with my patients, and when they come and they haven't come in a while, and they're like this and this, and then I'm like, oh my God, I'm like, you're broken. I go, what's going on? I go, you need like WD-40 and everything. Yeah. So I think it's just important for you to realize that you're human, and that you get to show up as human, Yeah.
And just finding out what makes that rapport connection like work for you. If it's your same jokes that you use, it's like things that and maybe you write in their sticky note in the chart. For me, it's like I have patients in my clinic from all over the world, and I speak Spanish not fluently, but well enough that I'm able to do my visits in Spanish. But even other languages, I know a little bit of Yoruba, Swahili, Somali, like other greetings. And
That's
even just
crazy.
saying, even just knowing a few greetings, it just so their face lights up because you tried. And then they can laugh and be like, you actually know how to say thank you, goodbye, how's your baby? Your baby's fine. And it's just so helpful for bringing that back as you're trying to keep moving forward. It doesn't have to take so long during the day, but it it just helps keep that human connection, like you're saying.
Yeah, like I try to make an effort as I'm coming in. Like I say, oh my God, it's September. It's December's gonna be here already. Or where did the
Mm-hmm.
summer go? Or what did you do this summer? What adventure did you learn? Like I try to ask them something. Uh, because then that just it's like you're talking to a friend, like it just eases into it. And then I say, well, I was looking at your labs right before I walked in, and I see that you've done so great, even though your A1C is still a 9, like you were a 13 last time, so that's really good. And so
Mm-hmm.
I think it's just about realizing that I think everybody's always trying their best, but of course some of us have a little bit more challenges than others. And so
Mm-hmm.
instead of asking them like what's wrong with you, you learn to ask like, well, what's going on, because then you can have more insight that it's not that they didn't want to take their med, they couldn't afford their med, or something,
Mm-hmm.
right? And so I think it's just like you said, making the effort to see them as the person, not the disease on the chart,
Mm-hmm.
right? Like that makes such a difference. And I think that's probably one of the reasons why I still have a job because I mean, when I had all those notes open, like that you're the admin's like worst nightmare, right? When they're like, we need to get paid for these things, right? I mean, they would always get done, but um because the rapport you build with the patients, and they keep saying like, oh, most amazing doctor, I'll wait 3 months, 6 months, whatever, right? uh it it just that just precedes and I remember like when I right now I'm working like 2 hours south of Houston, but I had for the longest time, for the 2 or 3 years later, like people driving down 2 hours to come see me. I'm like, you have a lot of doctors in Houston. What are you doing coming to a little town? Like, but it just shows you that, um, it's so important to have that connection.
Mm-hmm. So, as you think about that connection and yet those administrative burdens and where you were, what specific steps did you take first to help you get caught up and to be that proactive, intentional to get to where you are now?
Yeah, so I think my brain kept offering me the thought, you don't have enough time. Like,
Mm.
you don't have enough time for you, you don't have enough time for your family, you don't have enough time for whatever. And I had to ask myself, like, what are the things that I can do, like
Mm.
that would make a difference, right? Like, and I actually had to start thinking that way. And even though I kept telling myself I don't have enough time, like I knew that the investment in myself would make me find the time. So
Mm.
when I invested in EWP, which I never even knew what coaching was, I signed up for this program and I didn't even know what coaching was, but it just sounded like I was going to get some leadership thing, right? And then I was like, I wonder what it would be like if life coaching is cool. I wonder what if I invest in ADHD coaching, like that's even more specific. And I didn't even know that existed. Like I would have tried it since medical school had I known that was there. And so all of a sudden, like when I didn't even have enough time, I'm like signing up for private one-on-one ADHD coach, group coaching, and like trying to do life all while still having a full job and being clinical director. And then I got promoted to chief medical officer. So I think it was going back to like, what's my priority? Like what's gonna matter like in a week, in a year, like, and what do I have to let go of so that I can do the things that only I can do, or the things I really want to do, not that I have to do. And I think that was like the shift because, and believe me, at the beginning it was hard because even though I was paying like $300 or $400 for this private one-on-one session with my coach, I missed the first two because even though I was blocked in paper, right? Like I was blocked, they double booked it before. So like I was still in that mindset that, well, the patient comes first, right? And I remember one day I got home and I was so pissed. I told my husband, I cannot believe them. Da, 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 da. This is the second time I missed this. And I already told him, like, this is what I'm doing, trying to get back. And he looked at me and he's like, did they put a gun to your head? I was like, well, no. And he's like, so why is their time more worthy than yours? I was like, I didn't say that. He's like, but your actions did. He's like, you could have said, y'all double booked it. You tell them that I have an appointment, I have a meeting, I have whatever. From this time to that time, the patient is welcome to wait, or the administrator can go and explain why. And you do your thing. Like if you're already paying somebody or whatever. And so from then I was like, my time is more important. Like if I'm right, they're right. Like, you know, if I am 100% present, then they get better of me. And so I think it was those two situations and that conversation that again got me to see that, yeah, I mean, work would go on if something happened to me on the way home or something, right? They would replace me. I don't want to think that way, but it's true. Like life goes on for everybody who keeps living. And so when am I gonna be happy? When am I gonna choose me or my family? You know, if all I'm doing is charting, like I knew something had to change. So the first thing I knew, I couldn't be writing chapters. That's what I wanted to write. Like I wanted to be writing chapters of books. It was just supposed to be a page in the book, right? But in my mind, like I wanted to pretend I was the specialist I was going to send this person to, right? And so I was like, no, my job is to really, I started doing bullet notes and I just started to use my assessment and plan to mirror my HPI. And I started to get to like, what would I want to know in 15, 30 seconds before I walked into the next doctor's appointment, like, or to my colleagues reading, like before they walked into the room. And I started to consider them as they were just love notes for the patient. It was just what happened right now. I don't have to write the whole book. I just have to write what's going on today, right? And so I think my mind shifted from perfect notes to like done is better than not done, and done right now it's going to be more accurate than later, and right now it's going to take me 3 to 5 minutes and later it's going to take me 10 to 20. And so I just started to little by little start using timers, start using music, start using different things, and realizing that whenever I was getting tired, it was because I probably hadn't taken a break, or I hadn't eaten, or I had not set a boundary somewhere that got me into trouble. Like I allowed people to keep texting me or pulling me out of the room or doing different things that were distracting because, you know, I also covered the hospital. And then at that time I was covering the nursing home, and then I was doing the clinic. And so for somebody who doesn't have ADHD, an interruption like that could only take you maybe 2 minutes for you to get back on track. With somebody with ADHD, it might be 15 minutes. It's not that you're trying to do that, it's just you didn't set your, like, you need to tell people, give me a second, let me finish my thought, and then you answer, because then that thought's gone. And then good luck, right? And so that's why sometimes it takes us forever to reply to a text message. We saw it, but then we were distracted with something else. And then like a week later, you're like, oh my God, I didn't even reply back. And so it's, you start to realize where some of your blind spots might be that you didn't even know were blind spots. And then you just start to find systems or safety nets to help you to do that. So what I think what was most valuable for me was figuring out how to systematize things so that not I was responsible for everything in my M basket, figuring out, oh, let me order labs 1 week before and then have the patients come. So have the labs done,
Mm,
come see me, and then we talk about your labs. So then I don't have to be going through all the labs. Like they're coming so I can talk to them about it. And
yeah.
if they miss the lab, like my nurse would call them and be like, hey, you need to reschedule. So like having a system and then figuring out, okay, I'm not just gonna do it for me because I'm the clinic medical director. We're having a meeting, we're doing it all this way. So that way it doesn't matter if they're covering me or covering you, this is how we're doing it. Or like med
Hmm.
refills, like don't bother me, give them 30 days. And then if it's a controlled substance, they have to come see me every 3 months. Like
Hmm.
that's it. And not just for me, for everybody. We're all doing a contract. We're all like making it to where how can I make it simple for me, but not just for me, for everybody, so that the nurses are like, well, Dr. Mercado does it like this. Well, Dr. does it. Well, the nurse practitioner. No, we're all doing it the same way. Don't get confused. Like we're all on the same page. Um, I think when people realized the reason we were doing that was to decrease our burnout and our administrative stuff. Did the other people want to do it? Probably not, right? Because that's more work on their plate. But when they realized that they all get to go home earlier, then it worked out. You just
Hmm.
have to find a way to have others step up and
Hmm.
become team players, because physicians are not secretaries, even though that's what it feels like at the end of the day sometimes.
Yeah. I find myself, I have some time to help give some insight into how the EMR works and how to customize some things. And yeah, whenever there's an opportunity to say who should be doing this, or how do we get the computer that already knows some of these data points to be able to file them so that reports can be run. I don't need to check every single box. I shouldn't be doing that. And if we're going to add something, can we take something else away? Because, yeah, like you said, it needs to be the right person at the right time, doing the right thing. And even it's just bringing some of those things to awareness. So for me, our clinic had some remodeling construction, and that kind of shook things up. And it was finally the impetus for me to go even more room to room. And so I now finish probably 90, 95% of the time, can finish my note in the room, but I make sure I sign the orders, especially since I'm a pediatrician. I'll get the vaccines all queued up, say when I want them to come back. And if I want them to come back for vaccines, I'll often put that in my note so they don't have to call me or secure chat me in the EMR to say, what do you want for them? I already looked at it and I dealt with it. And then I go to the next room, because previously I would go back to the workroom and log in and finish my note there. But then I'd end up talking, because I'm social, even though I'm an introvert and I easily lose some of my train of thought. It just took extra time, the steps. But when the construction was there and I had to go way around, I just sat with that discomfort, that feeling, and allowed it so that then I could choose to say, no, I'm going to finish this. And even just telling the patient, I'm finishing up my note, and talk to the kids in middle school and say, does anyone like more homework? Either does Dr. Ryan. So that's really helpful, just what you did for yourself, but then with your leadership role, being able to do that for the clinic. I think that's really, really inspiring.
Yeah, I think that when you show up and and I mean it took a little bit to get over myself, right? Because I had this
Mm.
like shame about ADHD. But then when I started getting coaching, I was like, okay, kids, not that they're kids, but
Mhm.
that's how I felt. I was like, okay, kids, mom has a confession. I have ADHD. So please help me help you. So let's do this as a team. And and so I think it was really good that I did that, because then no longer was I feeling this like pressure that I was putting on myself. And it started a discussion. And
Mm.
you'd be surprised how many more people I've been able to diagnose. And And now it's like, okay, Dr. Mercado is the diabetes expert slash ADHD dash like anxiety and depression queen over there.
Mhm.
Because like we don't have an endocrinologist. And so that was just my expertise. Not, or I just loved it because I could see that when I could explain things to people that, yeah, like beans and rice actually are still carbs. They're like, what? And I was like, I know, corn too. They're like, what? And so you tell
Mhm.
them, and then when you start to see that they make changes, it changes. But to your point, like when you set up your system, like when you know what you're doing and then you start to automatize it, then even though it feels very painful at the beginning when you're starting something new or different, feels weird because our brain wants to go back to the old thing that might have been painful, but you knew the level of pain. Like
Mhm.
this, it's just a muscle, repetition.
Mhm.
And then eventually that becomes your new norm. And then when you don't do it that way, you're like, how come I would, like it feels off. And
Mhm.
so I think like for me, like I tell them, I literally tell them, help me help you. Like if the patient is telling you they have urinary frequency, get the UA before I walk in, like have it ready for me. Okay, they're here for a wellness, like look it up. Which vaccines do they need? Like here's the list. Give it to them. Like start the timer. Before I walk in, they already had it. Now if they want to have a discussion about HPV or da, 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 I'll have the discussion, but have it ready because they're gonna get it. Like 9 out of 10, I'm able to talk them into it. And so I think just knowing and then like training your staff, like telling them, okay, Dr. Mercado might address one or two things with you. She's not going to address 15. Like, what are your top two? Right. And so it takes the whole team to tell them, of course,
Mhm.
you want to talk to Dr. Mercado for 2 hours. She wants to
Yeah.
talk to you too, but you have to split it up.
Mhm.
Like, you
Yeah.
can't, you have to split it up. And so I think if you tell them to help you, then they can help you. Otherwise, if they don't, then like you're trying to be the quarterback and the
Mhm.
water boy at the same time, and it's hard.
Yeah. Well, and it just is empowering to them and it's an opportunity to train and invest in them. And I encourage them to say it's like, why are you ordering this? It's like that's not typical. And it's like, well, they're traveling and they needed their meningitis vaccine before their sixth grade shots, or whatever the case may be. Or then sometimes they'll be like, did you really mean to order that? It's like, oh no, I did not. Thank you for doing that. And so it's that team approach because I think for so long I thought it's like, oh, I have to do this or I have to call. And maybe that slightly abnormal result can be called in the next day or two. It's
Yeah,
not going to be an emergency.
yeah,
And
yeah.
so,
And it's also like realizing that if you tell them what you're trying to accomplish, like it could be so much helpful. Like sometimes your whole activity is like getting out so that you can go to your kids game or
mhm,
to a dentist appointment you're going to miss or to a conference that you're trying to fly out to. Like they still tell me, Dr. Mercado, that's being a little bit unreasonable. You're telling me you have to drive to Austin and you have to be there at 3 to get on that boat, but you want to leave at noon. They're like, I think you need to cancel the morning. And so sometimes like just sharing with them what you're going through, I mean, not all the
mhm,
details, but at least what you're trying to accomplish, then they can find ways and help you too. Like they'll be like, oh yeah, she cannot meet with you. Like if a drug rep is trying to talk to me at lunch, they're like, no,
mhm,
no, she has a meeting or whatever. So they can also be like, they can carve out your time and give you that sanctuary of 5 minutes for you to eat without somebody else taking away your time, right?
mhm. Or if you realize that your medical assistant is doing vaccines and blood work for two or three siblings, just recruiting one of their colleagues and saying, hey, can you room my next patient? And
Exactly.
so I think some of it's just that proactivity and that taking the time to really slow down and consider what the processes are. And then you can say, which little steps do we want to do? Because we've all done hard things. We've all done new things that seemed really awkward at first. I remember doing my second year physical exam training and seeing the standardized patient. And I was like, how do I put this all together? And then it's like now you just go take a history and physical, and it's a lot more automatic. So I think just realizing that it's a process and taking those first steps really
Yeah,
helps.
and then once you are doing whatever you're doing, like even asking yourself, what went well today? Like a lot of us don't take that time, right? Because we just like, whatever. And we think that what went well, the reason you closed your note is because you had 3 no shows. But no, it wasn't that. Like maybe that helped a little, but it was probably your mindset, or it was something that you did along the way, and realizing what are you doing well, or what threw you off, what was the distraction. And we don't take that moment in time sometimes to reflect because we're so busy trying to like keep going. But it's in that pause that then you were like, okay, yes, I really need to do this, or no, that doesn't work. And maybe being willing to like speak up and say, you know what, like I'm not the best at the end of the day. Let's put like 3 acute back to back at the last 4 slots, or a phone call,
Yes.
like 3 last phone calls, right? So that it doesn't matter when I call them at whatever time I call them, like it's okay. They're not in person here, like bringing down my neck or whatever, right? Like realizing if you're somebody who's like doesn't like to wake up early, like maybe start your clinic a little later, 10 to 4, whatever. Like you get to decide how, right? And not make it mean anything.
Well, thanks so much.
My clinic is so cool, like in the sense that we are open 7 to 7, but you as a provider get to decide. Like you can come in from 7 to 7 and work 3 shifts and call it full time and you're done. Or you could come in like 7 to 5, 4 shifts, or 8 to 3, whatever. You get to decide. However, as long as you see what you need to see, you're okay. And so that provides some flexibility for the moms or the dads who have to pick up kids from daycare and different things like that. And when you are thinking of the wellness of the people, then they stay, right? Because it's a family you're pitching in, versus like being non-flexible. And then we also have a Saturday clinic, which is cool because then we rotate one physician or one nurse practitioner on a Saturday. And then that means during the week, you have 1 extra day off for you to do whatever when you're covering that Saturday. So it's just being willing to think outside the box, to be creative, to ask, how can I show up the best for my patient? But before I show up for them, how did I show up for me first?
Yeah. Well, and just making some of those asks of like, this is what I need for my family in this season, but find ways to say, how can we make this a win-win? To speak leadership's language of saying, I was previously split at 2 clinics, as I was for the first probably 4.5 years. And then it's like, how can we make this work? It's like, well, actually, the clinic I want to be at, I have a lower no-show rate. I have more completed visits, and I'd be happier. So, and then I have more continuity. So it ended up being a win-win. It just took some time to get those moving pieces together.
Yeah, and it's you becoming aware of those, right? Like if you don't even know that those key things, it's hard for you to advocate for yourself because you don't even know that you were doing really good at this other place where you really wanted to be at.
So if you had one piece of advice for someone who's just coming out of training to say, how should they think about their processes, or even just to have whether they might need to get evaluated for ADHD, how would you advise someone early in their career?
Yeah, so one takeaway point, whether you're just starting your career as a resident or whether you've already been doing this for 20 years and you are still hitting your head against the wall, is give yourself 3 to 5 minutes before you walk into the other patient room. Your aim is to close your note, but if you are not able to, because some patients are a little bit more complex than others, still give yourself those solid 3 to 5 minutes to do your assessment and plan. Because usually the assessment and plan is the meat. It is the meat. And I don't know how your EMR is, but in mine, if I don't do it right there and then, I have to spend another 3 to 5 minutes just trying to figure out where I ordered, the vitals were, where it's like 5 clicks to try to figure out what I did that day. But if you give yourself the assessment and plan, then it's easy for you, if you can close it right there and then at the end of the day or the next day, to go back and be like, oh, I can put this in my HPI, I can put that in my assessment, in my physical exam, and then you're done. Like it literally takes you 1 or 2 minutes to complete thereafter instead of 10. And so that makes a big difference. That would be one advice. In terms of the ADHD or anxiety or depression or anything else that you might want to get evaluated, realize that, our energy levels or frustration or irritability might have to do because there is something where you are not really fulfilling your role. Like maybe you're not being efficient, maybe you're not exercising, you're not sleeping, you're not doing anything else. But you could also have hypothyroidism or something else going on. So it's important for you to realize that sometimes emotional dysregulation might be that you're just very irritable at the end of the day. And you might think that that's normal, but it's not really normal if all of a sudden people are looking at you like, why did they overreact this way? To you, it's so obvious, or it might not be. For me, it wasn't obvious that it was my inability to prioritize because everything coming at me felt like it was an emergency. And I didn't realize that, no, it really is not an emergency. Like her wanting me to put like an order for IV fluids is not an emergency. It's not going to trump me getting out of my room so that then I can go back into that room and then they have 5 other questions for me. So I had to like realize that, is there something there that is slowing me down? Is it me, or is it that I'm getting distracted, or what? And so what I'm saying is, with ADHD, sometimes we're impulsive. Sometimes we interrupt people because we're trying not to forget what they're telling us. Sometimes we look really moody. And so I say all this because you might be labeling that physician as lazy or disruptive or whatever, but it might be that they're really trying their hardest. It's just that they're not aware that they don't know that they don't know, because maybe nobody's told them that they could have ADHD or they could have autism or they could have something else, but because probably their love for that field is fueling them to finish and do whatever. So just approach it from the perspective, hey, you could approach it like, hey, I see that, you seem like you might have been struggling, or you were upset yesterday. Is there something going on? You don't have to tell them you have ADHD or anything, right? But you could just say, hey, I see that something might be going on. Can I help you in any way? Or, sometimes just normalizing it and talking to them, like, can seek the awareness. Like, I would have never known I had ADHD had my roommate told me, Yana, I see you studying like 80 to 100 hours and I don't see you retaining information. You read that 3 times already. What's going on? And so had she not told me that, I would have thought, well, I don't know, maybe English is my second language. Like, I have to read it 3 times. I don't know all these medical vocabularies, right? But it took somebody else observing that. So I think, well, now I can look back and be like, oh yeah, my family. But at that point, I couldn't, because that was just my norm. So I think what's important is that if you feel like maybe you're working a little bit harder than your colleague, and it's not to compare and despair, but you will know if you're like, how come everybody's at home and I'm still here? Like, you have that time blindness and you don't even know you have it. Like, just look into it. And I can send you a link if you like. It's a journal on how to identify ADHD in physicians, and it's a really well-written article that has these conversations on how to help identify it.
Great. I can include that in the show notes. If someone wants to learn more about you, how to work with you, where can they find you online?
Yes, come to my website. It's ADHD-lifecoach.com. Or you can find me on TikTok or Instagram, Beyond ADHD, a physician's perspective. And if you do go to my website, like every month, I have a free webinar where you can come and like learn like in basket tips or charting tips or boundary tips. But what is important is that you just invest in yourself,
Mm,
whether it's with me or with Ryan or with anybody out there who is teaching you how to improve your work life, because you
mhm.
are your most important investment. And I mean, how much money do we spend trying to get through med school? And then how much money do we invest in our houses, in our purses, in our things, right? And those, they depreciate. But what you put in your brain, the quality in, quality out. So think about that. Think that you are worth this investment, because I know usually we don't prioritize ourselves. But when you do, oh my God, it's amazing. It's a ripple effect that happens. All of a sudden, you're the better mom, better wife, better patient, better physician. And you're not even trying. You're just more better you. And not because
Mm.
you need it to be, but just because all of a sudden you start to align with what you really want it to be. You start dreaming again.
So great. Thank you so much, Dr. Mercado, for joining me on the MedEd Well podcast and sharing such amazing insights.
Thank you for so much for having this platform and inspiring
Mm,
everybody.
Thanks. For all of you listening, I want you to consider how you can apply what you've learned from Dr. Mercado in today's discussion. And then please share this podcast with another doctor in your life and subscribe to the podcast. You can help change the culture of medicine and promote wellness for your patients, your colleagues, and yourself. Thank you so much for all that you do, and have a great day.